Good afternoon. Today I'm going to be talking about tuberculosis, which is a potentially serious infectious disease that mainly affects your lungs, and this is caused by a bacterium called Mycobacterium tuberculosis. This is a fairly large, non-motile, non-capsulated, rod-shaped bacteria that you can see right here in the picture that I provided. The rods are 2 to 4 micrometers in length and 0.2 to 0.5 micrometers in width. It has a unique, complex, thick, waxy-like cell envelope with properties such as low permeability and resistance to entry of many hydrophobic antibiotics and resistance to harsh environments, which does distinguish Mycobacterium tuberculosis from other pathogenic bacteria. Mycobacterium tuberculosis does not retain any common bacteriological stain due to its high lipid content and its wall. That is why neither gram-positive or gram-negative is used, but acid-fast staining is. Acid-fast stain is used to identify acid-fast organisms, such as members of the genus Mycobacterium. Next slide. Tuberculosis is a major public health problem in India. The country has the largest number of tuberculosis cases in the world. The total incidence shown here for India in 2017 was 2,740 cases out of 1,340,000 population. As far as the prevalence came, I could not find sufficient data or a reliable source due to there being a lack of consistency in the numbers that I found during my research. So I did not want to include any of that into my presentation because I didn't want to give false information. Mycobacterium tuberculosis appears to be the greatest during winter months. Vitamin D level, indoor activities, seasonal change in immune function, and delays in diagnosis and treatment of this disease are potential stimuli of seasonal tuberculosis disease. Naturally, during this time, our immune systems are already not as high. Therefore, in some cases, tuberculosis is inevitable to people who already possess weak immune systems year-round. A fact I found that affects tuberculosis is that the risk of getting the infection is highest at low temperature, low humidity, and low rainfall. Next slide. Some examples of people who are more susceptible to tuberculosis are ones who work or reside with people who are in high-risk places, such as facilities or institutions like hospitals, shelters, correctional facilities, nursing homes, and residential homes. Homeless people, injection of drug users, and persons with HIV infection have higher rates of tuberculosis transmission, which is the spread of tuberculosis. People who have immigrated from areas of the world with higher rates of tuberculosis, like India, for example, are more at risk. If you recall to my previous slide, they have the largest number of tuberculosis cases in the world. Traveling to these places or traveling during winter could all play a part in who is susceptible to tuberculosis. Therefore, traveling isn't always recommended during winter due to it being when tuberculosis is at its peak. Next slide. Babies and children often have weak and underdeveloped immune systems, making them especially susceptible to this infection and can be life-threatening if contracted and not addressed medically. Other people that have weak immune systems may be due to some of these conditions like diabetes, severe kidney disease, low body weight, organ transplants, head and neck cancer, or specialized treatment for rheumatoid arthritis. These are just some of the few that could be responsible for a weak immune system. Next slide. Tuberculosis is able to cause disease through spread of air. It is completely airborne. When a person with this disease of the lungs or throat coughs, speaks, sings, or sneezes, and people nearby breathe in this bacteria, they become infected. You can see this as an example in the pictures I provided. The one to the left, you can see a man sneezing, and you can see all of the germs spreading to the not infected man. Therefore, he will most likely contract the infection. And the next one to the right is a person sneezing or coughing, and you can also see his germs, which are now spreading because it's in the air. Mycobacterium are known to adapt to their metabolism to the host environment by alternative energy and carbon sources. Mycobacterium tuberculosis mainly uses host-derived cholesterol and fatty acids as an energy supply instead of fermentable energy sources. Fermentable energy sources are carbohydrates such as starches and sugars. Next slide. The host immune system defense from pathogens is lodged macrophages in alveoli called alveolar macrophages. You can see the green circle lining, that is the alveolar macrophage. When the macrophage detects the presence of a pathogen, it phagocytizes the mycobacterium into a cell through a process called phagocytosis. The normal immune response is for the lysosome to fuse with the phagosome to form phagolysosome, which would dissolve the pathogen with acids and it eliminates it, thus terminating the Mycobacterium tuberculosis. But if the pathogen inhibits the fusion, it allows Mycobacterium tuberculosis to remain protected inside the macrophage without being detected by the immune system. Next slide. The human host serves as a natural reservoir for Mycobacterium tuberculosis. Transmission occurs when a person inhales droplet nuclei containing the disease, and the droplet nuclei invade the mouth or nasal passages, upper respiratory tract, and bronchi to reach the alveoli of the lungs, which is where the bacteria usually tends to attack. And so here in this picture, you can see all the bacteria coming through the droplets and now going into another uninfected person. Next slide. Now I'm going to go a little bit further into transmission of this disease. First, we're going to look at the pictures I provided to the right. The mycobacterium gets entry into the lungs and resides in the alveoli of the lungs. Second, it then starts with the primary infection, and if the immune system fails to eliminate it, there are 3 case scenarios for mycobacterium in the alveoli. Those case scenarios are elimination, retention, and active infection. In the elimination phase, our immune system completely eliminates the infection, which is what we all want. In the retention case, the immune system suppresses the infection, but the bacteria remains viable, and in this case, we would call it latent tuberculosis. The mycobacterium builds the immune response and separates the infection in the lung tissue, and at the same time, where there's an active infection is called active tuberculosis. And to the left, you can see it's a nice little diagram. The purple shows the Mycobacterium tuberculosis, and you can see, if you follow the arrows, the droplets from coughs and sneezes by an infected person then go into an uninfected person. I thought that was a very good picture to show visually the transmission. Next slide. As shown in this diagram to the right, some signs and symptoms of tuberculosis are chest pain, weight loss, chills, long-term cough, fever, fatigue, night sweats, lack of appetite, and coughing up blood. Some other symptoms that weren't mentioned could be shortness of breath, swollen lymph nodes, loss of muscle, and excess phlegm. Spinal pain is back pain and stiffness, which is a common complication of tuberculosis. Joint damage is when tuberculosis arthritis usually affects the hip and knees. swelling of the membranes that cover your brain. This can cause a lasting or intermittent headache that occurs for weeks, and sometimes mental changes are possible. Liver or kidney problems. Your liver and kidneys help filter out waste and impurities from your bloodstream. These functions can become impaired if the liver or kidneys are affected by tuberculosis. Heart disorders. Rarely, tuberculosis can affect the tissue that surrounds your heart, causing inflammation and fluid collects that may interfere with your heart's ability to pump effectively. This condition is called cardiac tamponade, which can be fatal. Next slide. Tuberculosis is caused when a person breathes in the bacteria that is in the air, so it is important that people with the disease who are not on effective treatment do not release tuberculosis bacteria into the air when they cough, which leads me to cough etiquette as a prevention of transmission. As you can see here in this picture, there are 3 solid ways to stop transmission of this bacteria, which is to cover your mouth with a tissue, wearing a mask, and cover your face with your elbow. Any of these should be done when coughing or sneezing. In order to treat the symptoms, you must finish your medication prescribed from a doctor. If you stop taking the drugs too soon, you can become sick again and potentially spread the disease to others. By taking the drugs incorrectly, tuberculosis germs that are still alive may become drug resistant, making it harder for you to get better next time you contract the infection. The most common medications used to treat tuberculosis include isoniazid, rifampicin, pyrazinamide, and ethambutol. You can see those names in the picture I've shown in the right because I butchered how to say them. You can also see in that picture I provided the duration of treatment for each drug. As far as the mechanism of drug goes, the tuberculosis drugs target various aspects of Mycobacterium tuberculosis, including inhibition of cell wall synthesis, protein synthesis, or nucleic acid synthesis, to eventually eliminate Mycobacterium tuberculosis. The following slides are all of the sources I used to obtain the information for this presentation, and I also cited each source at the bottom of each slide. Thank you for your time, and I hope you have a great rest of your day. Bye.